So Ellie, because she was waiting for so long, put about 5,000 layers of numbing cream, which has slowly resembled concrete on her face. So we're nearly there. She probably won't be able to speak for about a week with all this gel. So normally, Ellie does have treatments that are about 1.45. That's her norm. But she's on the back end of a bit of contact dermatitis, so I thought I'd be a bit kind to her at the minute. I think her skin needs a bit of a hug rather than burn, baby, burn. So while I'm doing it, we're going to do a full face, obviously around her eyes and her neck as well. So anyone has any questions, just blurt them out, and we're good to go. Will you stop getting involved? Stop getting involved. Oh, I'm joking. I'm trying to do it from this way, so if I look cat-candid, I just thought, because on this, you couldn't see it if my big backside was in front of it. So when I start, very similar, I think one of the main things that I've changed in the last year, sort of the first 100 NeoGens versus the latter, has been really focusing on what I do with them before they come to me. And I think that's been a message that everyone has said today. Anyone who's experienced with it knows that that has a really pivotal role. And I think from last year's summit, we started doing the electrolytes, which have been a massive winner, the skincare, making sure that that's nailed, but also using the Dermalux as well to really work on reducing that inflammation in the skin before they start. So she's really fluffy. She hasn't had a dermaplane clearly in a long time, so prepare for some smoke. It's coming. So she's only going low level, so she shouldn't wince. She's been paid to make sure she doesn't wince anyway, so. So I tend to do my 2 passes straight away because I'm a bit mean. And I think one of the things I've always done is I kind of go cross like this, but then I will always intertwine with a different directionality. This logic, so obviously hearing your talk, Angela, was like really interesting in terms of the vectors, because the way I've always tried to do it is I think about almost like that surgical cut, like what direction is that surgical cut going to be in, and that's, you know, considering the muscle position, and that's kind of the logic that I use in terms of the directionality that I go in with the NeoGen. So I kind of start laterally, but then I work up vertically as well, depending on where I'm going.
Do you always separate the handpiece so much?
Do I, sorry?
Always separate the handpiece so much?
What do you mean separate?
Like you're not hovering right above.
It probably is because she's really low. So I normally she'd be up here. So if it's a little bit further away from the skin, it's probably just because she's a bit lower than normal.
Okay.
But I would normally aim for about no more than 3.5 millimeters away from the skin. That's where I'd normally aim. I'd never go less than that. Never go further away than that.
Right.
You're not allowed to flinch. Stop it. This is really comfortable, remember.
I'm not in any pain.
What do you remember? Which ones are they Revive? I think they're anyone who's on the NeoGen group. I haggled a discount for anyone who had NeoGen, and I put it on there, so it will be on there on the links. But from memory, it was Revive. I liked it because it comes in the handy little boxes, so they can kind of just pick them up. I'm just going to switch over and jump between sides.
How many shots have you done then, please? Could you just tell me?
I wasn't paying attention of my starting point. That's true Kate fashion. To be fair, I'll tell you, somebody asked me this earlier on, and I can honestly tell you that I never really approach 2 patients the same. I always, one of the things I will always say, obviously one of my other roles is I run a company called the Nurses Network, and there are literally hundreds of new injectors or established injectors on there, and they look for support. So anything kind of device or NeoGen related, they usually get in touch with me and ask me questions. And one of the things I often get asked is, you know, what am I doing to prime them, or they've had something not go quite to plan. I'm not going to say a complication because it's very rare, but I always say that it always comes down to the consultation. Like, if you didn't dig deep enough, didn't prime well enough, you know, didn't really assess the skin well enough. And I think as long as you're doing all those things and tailor your treatment, I think at the beginning you just get in this habit of following this blanket protocol for everyone, and you just can't. You know, I proved, like, I had 2 patients who were vegan, who had 3 treatments and had borderline 0 change. But I didn't know at the time they were vegan. This is a year and a half ago. And now it's a question we ask immediately when they come in. And the reason for that is if they're vegan, they're going to be deficient in those key amino acids. They're not really going to have those within the body, not going to have those raw materials. So I need to know that so that I can prime them with those amino acids before I do the treatment. And we've got both of them back in. We did amino acid boosters beforehand. We give her amino acid supplements, and we used it immediately after. And after 1 treatment, the results were ridiculously just amazing. I was like, okay, point proven. Next time, ask the question. Otherwise, you're giving away these free treatments, and that's bad business. But it was useful because it kind of just opened up the fact that we need to ask questions so we can set them individual plans. At break, like nigh on everyone who come up to me was asking me, do I use exosomes with every patient? Absolutely not. You know, I really don't. But they, you know, they have a place for the right patient. But I certainly don't do it for everybody. Just I don't use the NeoGen spatula because when I had the NeoGen the first time and when they used that on my face, I hated it. So I just use a gauze when I'm going round. And I think the pressure sometimes really helps, especially around the eyes. So I use Jalapro, but mainly that, it probably sounds like you're probably thinking, yeah, okay, you are a KOL for them, so you're going to say that. But I used them before I was a KOL for them. I published like 7 studies for them in combination with different things, and then I became a KOL. And the reason being is I just think it really has a place. You know, not for everyone, don't get me wrong, but for the right patient, it absolutely has a place. And just turn your head a little bit, thanks, Sam. So we tend to, and it really depends on budget. So if someone's coming in, every single person, we build in that they'll have the classic product, you know, the vials that it's got 100 milligrams of amino acids and then I think 70 of the hyaluronic acid. So I usually just put that on topically the minute they've had the treatment. I think I did a reel doing it the other day. But if they've got the budget for it, or if they're vegan, or again, I'm not demonizing vegans, so don't come at me with that please, because I promise you I'm not. But it does have a role, you know, so I have to consider that. So if they are, then I'll tend to do a little bit more heavy duty. And what I tend to do is see them for a couple of weeks before, a couple of months before, and maybe do a course of 3 HMW treatments. So they're just a little bit more of a booster treatment. But everybody gets the classic, because after I used it and I seen how much better the results were, it was just a no-brainer for me. I was like, I need to build this in because, and then also it opens them up once they've had the course in NeoGen and they go, what do I do now? Well, we'll just continue with your amino acid replacement therapy until it's time to have more NeoGens. So that's kind of what we do. Right, so you'll see your head's much redder. So I've kind of gone across in this direction, and then once I've done the 2 passes, I've kind of gone across again in vertical. I found Ellie has this mainly. We started doing it with Ellie for a brow lift, and that's probably one of the most common things that we do, and we get great results lifting it. But I think the key is treating the forehead appropriately and the temporal region as well, because you do get that nice repositioning of the brow, which is great. I'm just going to protect her brow a little bit. If you keep your eyes closed, Mrs. Lash Queen. I'm not a fan of these 2.5s. I tend to, most of the time, use a higher nozzle. So. Well done.
Thank you.
Stellar performance. Yeah, I think they're called the Revive ones. I'm pretty sure that's what they are. They're like the blue writing. I've got Revive in my head. I'll double check at the end. But when I got them, there was no other reason for it. It's just they were recommended to me. So we started using them and everybody loved them. And because they come in lots of different flavours, they're sugar-free, all the rest of it, people really like them. But, you know, that was just the first one that we started working with. And people really liked it, so... Of course I do, yeah. I think it just like what Julie was saying earlier on, you know, people always say when they're starting out their aesthetic business, they kind of run with it. They do the training, they open up, and then they wonder why they're not busy. And I think it's because we don't necessarily do the stuff we should do at the beginning, which is all the business planning, the marketing, figuring out what our USP is, thinking about how to package ourselves in a very busy and, you know, I hate to use the word saturated, but I prefer to look at it as busy market with lots of potential. So I think, yeah, it's the same with NeoGen. When I first bought my NeoGen, there was no one in my area who offered the NeoGen. So I had the market, but I don't gatekeep, and so many of my friends do this job, and we talk, and I told them you have to have it. Like I shoot myself in the foot. Now everyone has one near me, but so they should, because it's great and the patients will benefit. What they can't do is they don't necessarily have the benefit and the experience that you have in terms of putting those packages together. And it's about putting a package together. We've got slightly different prices for me, but it's £750 for a single treatment, £2,200 for a course of 3. But they get electrolytes, they don't get the continuous, they get a box of electrolytes, all the box of amino acids. We choose which one depending on their need. They also get unlimited, phototherapy while they're on the course, because that's really important. We make them use it at the beginning to bring down their inflammation, but then we also get them to come in and have it in between. We use a mixture of the red light and the NIR. The red's going to further kind of induce that neocollagenesis. It's going to enhance the results, and the NIR is great as well. So, how are you feeling? Burny. I'm going to do your upper lip, so if you pull your lip down for me. There we go.
Can't really feel it.
Can you? I was going to say you're very shiny. It can be quite tricky. When I did that study that we presented in China, that come up because that study was polynucleotides and NeoGen. And for that, sorry, I should have given you pre-warning, shouldn't I? And for that study, I brought them in 1 week before the NeoGen, and then I did the polynucleotides and brought it back. And everybody said to me, "Why did you do that? Why didn't you just do it at the same time?" And I have no logic, but to me, I just thought, I want it to actually start doing something. When it's first in the skin, it hasn't worked on any receptors. It hasn't done anything yet. So, I just didn't see the point. And I know so many people do it at the same appointment, but for me, logically, I just didn't see the benefit of doing that. I'm going to do your neck now, hon. I'm just going to do around the bottom of your jaw first and then work across. So my answer, Simon, long-winded as per usual, is I probably still would do the injectables first, which is why a lot of people get annoyed with it, because it can feel like it's really drawn out. So I think that's why I love the fact that the classic product can be used immediately after, why the skin's like super permeable and receptive to it. And I know Tyrone said, like, the research says that it's, how long, where's Tyrone?
Is he?
How long did you say, Tyrone? What was the time frame you said? For how long the skin's permeable? Did you say 12 hours? No, you did 6 hours.
6 hours on the one that done in Swansea, and then actually the one from Tokyo suggested there may be a closing window over a 24-hour period.
Yeah, because like for when I've given anyone exosomes, for example, I give them exosomes to take away with them and use in that the next day. And they say to me it absorbs just as quick as it does immediately after. So that would suggest to me that it's still quite permeable, so it's beneficial. But I always make sure I control exactly what they're putting on 7 days after, at least. you know. So we just make sure within the packages that we offer, it includes the LED throughout, it includes the electrolytes or the amino acids, it includes a growth factor serum to use immediately after. How's the neck feeling? Yeah. So the molecular weight of the classic is small enough to microneedle. So essentially, as soon as they're finished, I think once you reconstitute, it's got 100 milligrams. I think the minute you reconstitute, I think it's about 2.5 mil you get, which literally just gets sucked right in. And I just use that topically.
He has a terrific scar on the left side of her neck.
Oh, yeah, yeah.
Chickenpox scar.
Burn, baby, burn. I'm being kind to her today. We've never actually done your neck before,
No,
have we?
First time.
I just thought. She's young.
Supple.
Oh, God. Is that a dig at me? Somebody else said this before about scarring, and I think it really depends on the scar, doesn't it? Because if you've got someone with, if you need to do subcision, if you want to go, like what Raj was saying earlier on about the different things that we've got in our belt, but I think I would tend to go higher energy with the scar, definitely. But I would probably do, for the majority, what I tend to do with the scarring is I do a pass quite high energy, and then I tend to reduce the energy a little bit on the next one and do more passes. I don't know. It depends on the scar though, because when I do surgical scars, we go quite soon. So, like I think tomorrow I've got a picture of a lip lift one. We had the day she came in for stitches out. I took her stitches out, I think on day 9, and then straight away I went in with the NeoGen. I know Tyrone's probably squirming behind me. I'm not looking at you, Tyrone. Because I think that's just I just thought I'm going to do it. I know Tyrone will shout at me, but I'm going to do it anyway. And actually, it was great. But obviously follow what Tyrone says, not what I say. But I just did like 1.42 passes. And then I put exosomes on it straight away. And her scar at like 3 weeks, couldn't even see it. Non-existent. It's on tomorrow, like literally non-existent. And because we do a lot of like emergency trauma clinics, so we'll get, on average, we get 17 patients a week coming in who've had surgery abroad, primarily Turkey, if I'm being honest. And they've always had multiple surgeries, usually multiple surgeries in one go. It's never really one. And by and large, they've all got some kind of wound or infection or healing problem. And I genuinely use the NeoGen so much when I'm dealing with their scarring at some point. Once we've given them a hug and took them through the, the immediate trauma, because I think that's what it is. It's emotional trauma, isn't it? So I'm just going to do that middle bit again. And the next one, how's your neck? Do you feel hot?
Yeah. About the first time it's ever been done there, so.
There you go. And you cooked.
Cooked.
And she's done. Right, let me give you a quick wipe, because you had lots of singeing then, so I'm going to give you a wipe with Clinicept.
How do you feel about treating people who haven't removed the hair? Do you feel that it can add extra pain to the treatment?
What do you mean in terms of like?
It's not dermablade.
No, I don't think so. I think
Or stop the treatment working?
not really. It's still the purpose of the reason it's kind of singeing is because you've created because of the heat. It's still getting delivered. I can't see it impacting the treatment in any way. To be honest, I think. No, I don't think. In my opinion, I don't think it impedes the the treatment at all. I'd probably be more inclined for them not to. I'd rather they didn't go dermaplaning the skin a week before they had the NeoGen or doing anything like that. I'd rather they'd leave it. Most of my patients who are darker skin, whether it be Italian or Asian, you know, they do tend to have a lot of hairs on their face. And sometimes, I can't remember, somebody said it earlier, sometimes that can get quite smoky. it can, sometimes you think you're going to ignite something. But I just, you know, extra cautious, take my time with it, but yeah. Because she had, who asked that question? Oh, hiya, sorry. Because when I was going, she had lots of singed hairs. So that's the only reason I'm cleaning.
This is just,
Yeah.
if the wet technique works, is it because there are reactive nitrogen species left on the face in the gel? And if you wipe after the treatment, are you actively removing some of the reactive nitrogen species? Dr. Klishko.
We caught you out. You were not paying attention.
She's wiping down the skin after the treatment. Do you think she might be removing reactive nitrogen species that are on the surface?
So when we apply water, everything is wet around all the area, and I just move with the
Sit up if you want. Just sit
sorry.
on the side.
every time I just remove it
Yeah.
and
I think, well, when I've treated a patient who's like one of my Italian patients, literally, especially when I'm doing the lateral portion of her face, it will literally be brown with hair. There's no way they're leaving like that. Now, whether I clean it off or they do it in the car by licking it and taking it off, I'd prefer to take it off myself because they're going to take that off. And most of the time, I'm putting something on their skin anyway. You know, it's permeable. I'm cleaning the skin, getting rid of that, and then I'm getting that. I want that max absorption of whatever I'm putting on next. Because that's really important what we use next. And for me, it's usually at this stage growth factors. That's normally what I put on, unless I was worried about pigmentation, in which I would opt for impurisomes.
There is a study that actually talks about cleaning the skin post any EBD treatment, because the biggest reason that's going to contribute to potential skin breakouts or infections is often what you're leaving on the skin. Particularly with this, you'll get a lot of singed hair. And if you were to look at what she's rubbed off Ellie, you'll see it's quite brown and grey. So it's about making sure that we're not putting any greater risk to the treatment afterwards.
Disgusting. Judge Ellie, everyone.
Don't know that one. I think we need more research on that.
Was somebody asking me something there? Or was I making that up? No. But yeah, I would use growth factors, and sometimes if I've used a higher energy treatment, I know people find this controversial, but I would then put them on usually the Dermalux as well immediately after. I know people say don't do it, and they say, why do I want to get rid of that inflammatory stage? But same way as I think of a surgical wound, I think of all the stages that wound is going through, whether it be inflammatory, proliferation, remodeling. I don't really want them to stay in that inflammatory stage that long. I want them to go through it and get out of it and move on to kind of the good stuff. So I kind of consider that the same. I want to regulate that inflammatory stage. So I usually put them on the NAR before and after, but then in between I'll do other stuff. There's I won't mention his name, but there's a doctor that does a different treatment. He does it with laser, and he's a big fan of one and done treatments, as he refers to them. And he in one session will do various injectables, and then he will do a laser or a NeoGen at the same time. So he will do amino acids, polynucleotides, PRP, and then a NeoGen and Dermalux to finish. And his logic is he's priming them from every way, shape or form. And he, like, I get the logic. And when I watched him present once, and he got up on stage probably 40 or 50 images, and the results were incredible, really. But kind of makes sense if you want to create that change, you want to rebuild that collagen, you're going to need those raw materials. You're giving it to them. I guess, whether you love or hate polynucleotides, you know, they suggest they stimulate that through receptors, whether you believe it or not. You know, I can see the logic. And then obviously with the phototherapy, you're kind of working on the ATP and the mitochondria. So you're kind of giving the cell the energy and the raw ingredients to convert it as well. So logically, I see it makes sense. But I do think it requires us, therefore, to package it and make sure people are getting that pre and post journey from us as well. I don't think you can rely on patients to do it. Some of the stuff I've seen patients go to put on their face after a treatment, like, blows my mind, literally, even with wounds.
I've seen NeoGen really help with seborrheic dermatitis. Do you think there's a place for NeoGen in superficial fungal infections?
I think so. I think even with, I'm right, am I wrong here, Tyrone? But there is a lot with, even with the toenail infections, isn't there? There's plenty there.
You'll see antifungal also.
Absolutely.
Fungal
Wedding we did one.
Oh, yes. So, yeah, I can't remember. I think you just had a build-up of epidermal dead skin cells, and then she ended up with a little, you could see all the lumps, so it's obviously fungal. She was opting for the Head and Shoulders. I said, let's do a NeoGen instead. And we did, I think, 2 treatments, 1.4, and it cleared it right up before the wedding. So, yeah, definitely has a place. I think we're just touching the brink of what we can do with NeoGen. And I think that's why it's so great to have the community, so everyone can kind of share these things and learn from each other, so we can evolve and create new protocols and create those case studies, so people who are just starting out feel a little bit more safe and supported to kind of try it out. But yeah. Any other questions before I leave you to your margaritas? I mean to go home. No? Well, oh, go on, hit me up.
I do a lot of work like you with one arm.
Yeah.
I've got a problem with my shoulder.
Yeah.
Do you have any ways to use that machine so that your body is not under stress?
Truthfully, my physiotherapist kicks off at me all the time, but do you know what it is? It's years of teaching fillers. And I remember once I did it was one of my first ever training days that I did with Teoxane, and I had about 25 people in the room, and it was the first time I ever did it with these people in this small room, and I went to move around the other side of the bed, and watching 30 people move to the other side of the bed, I thought, I'm never doing that again. And I just decided to always inject and treat from one side of the bed, and it's not good for you. I can tell you that, but no, I think I just try it when it comes to the NeoGen. I'm always, luckily we've got the bed in the room, so we're not leaning too much. Before, when we had the other previous bed that we did the NeoGens, I used to shout at her because she was like always hunched. I was like, you are not suing me anytime soon. Sit down, please. But we just did with it. But I used to use the foot pedal. I don't do that anymore. Now I just use the handpiece. I don't know why I changed. Maybe I was just mixing it up.
The new handpiece is so much easier.
It is.
Isn't it?
Yeah, when I changed the machine, the new handpiece is easier. But yeah. Any other questions? And I don't sing karaoke, but after 2 margaritas, I can try. Okay. Thank you.